If you're on Ozempic or any GLP-1 medication and you have surgery coming up, there's one risk that almost nobody is talking about, and it could turn a routine procedure into a life-threatening emergency. And I'm not saying this to scare you. I'm saying this because with the number of people taking Ozempic and other GLP-1s currently, I'm seeing this more and more. And most patients have no idea. Hey, I'm Dr. Dani Fisher, and I'm a board-certified anesthesiologist, and I deal with anesthesia risk every single day. So let's start with the basics, because this is the foundation of everything. When you go under general anesthesia, your body is completely relaxed. Your muscles aren't working, your reflexes are turned off, including the reflex that protects your airway, and your airway turns into your lungs. Under normal circumstances, if something comes up from your stomach, your body coughs or gags or closes off your airway automatically. And this protective reflex is something you don't even have to think about. But under anesthesia, that protective reflex is gone. So if there is anything in your stomach, food, liquid, anything, and you don't have a gag reflex activated to protect your lungs, that food can travel up your esophagus and directly into your lungs. This is called aspiration. It's important to note here that the stomach contents are very acidic, and when that acid gets into the lung tissue, it causes severe damage, and in serious cases, it can even be fatal. This is why we tell patients not to eat or drink before surgery, and we call this NPO, nothing by mouth. The goal is a completely empty stomach before we ever touch your airway. So what do Ozempic and other GLP-1 medications have to do with aspiration? Well, that's what I'm gonna explain now. Drugs like Ozempic, Wegovy, Mounjaro, and Zepbound work by mimicking a hormone in your body called GLP-1. One of the things that hormone does is slow down gastric emptying, meaning it slows down how quickly food moves out of your stomach and into your intestines. For weight loss, that's the whole point. You feel full longer, you eat less, but here's why this matters for patients that are undergoing anesthesia. When you are on one of these medications, your stomach may not empty on the normal schedule we expect, even if you followed all the rules and you stopped eating at midnight. In fact, a recent study showed that almost half of patients who have taken a GLP-1 in the last 10 days have a full stomach when an ultrasound is done prior to their surgery. That is how powerful these medications are at slowing gastric motility. And the longer you've been on the medication, the higher your dose and the more pronounced the effect can be. The takeaway here is that when you're on a GLP-1, your stomach is not behaving like a normal stomach, which increases your risk of aspiration. So what do we do about this? Well, the recommendations continue to evolve as we learn more and more about these medications. And right now, the guidance from the American Society of Anesthesiologists recommend holding GLP medications before elective surgery. For weekly injectable medications like Ozempic or Mounjaro, the recommendations is to hold the medication for one full dosing cycle, which is typically 1 week before your procedure. Some institutions and some anesthesiologists are recommending 2 weeks to be more conservative. Now, if you are a person who's taking these meds and you have symptoms like nausea or vomiting or reflux or bloating, or if you are in the dose escalating phase, or if you initiated therapy less than 12 weeks ago, you are going to be at greater risk for aspiration, and you'll find that most anesthesiologists will cancel your elective surgery if you have not stopped your GLP-1 1 to 2 weeks prior to surgery in order to keep you safe. For daily oral GLP-1 medications, the recommendation is to hold it the day of surgery. Now remember, this guidance is for elective procedures. If you're having an emergency surgery, we can't delay the surgery, and we have some tools that help us decrease the risk of aspiration. But for anything that's planned, the stopping window really does matter. In my practice, I ask every single patient about GLP-1 use during our preoperative assessment, but not every facility has caught up to this yet. So be your own advocate. Tell your anesthesiologist what drugs you are on, the dose, how long you've been on that medication, and if you are having any symptoms, and specifically symptoms like nausea, vomiting, heartburn, or bloating. If you have questions about what you should do regarding your Ozempic or other GLP-1s before your surgery, be sure that you call your surgeon's office and they can guide you, or they can get you in touch with your anesthesiologist who can then answer your specific questions. This will help prevent getting your surgery canceled. Be sure you share this video with somebody you know who takes Ozempic or another GLP-1, and like and subscribe to this video so that the algorithm shares this life-saving information with other people. If you've had surgery canceled for not stopping your Ozempic, definitely leave a comment below. For now, stay calm, stay informed, and I'll see you in the recovery room.